Hello everyone, we are going to discuss today the ventricle systems. I welcome you in this discussion. In the ventricle system, we're going to learn the components, the topography, communications. We're also going to look at the choroid plexus, the CSF. Also, we're going to look at its circulation and some clinical relevance of the cerebrospinal fluid when we move further. So what is the ventricular system? The ventricular system is an extension of the subarachnoid space into the brain, and it is consisting of a series of interconnecting chambers which is filled with the cerebrospinal fluid. That is important. It consists of one paired ventricle and two unpaired ventricles. The paired ventricle is called the lateral ventricle. It's on both sides, and the unpaired ventricle is the third ventricle and the fourth ventricle. All of these ventricles are connected with each other with the different structures. We're going to look at those intercommunicating structures. The cerebrospinal fluid, which is the most important part of the ventricular system, it flows through the ventricles before it enters the subarachnoid space of the brain and the spinal cord, and then of course it's going to get reabsorbed back through the dural venous sinuses, which we have discussed before. So let's look at the ventricle system in much more details now. So the very first one we're going to look at is the paired ventricle, which is the lateral ventricles. It consists of a body, anterior horn, posterior horn, and the inferior horn. So if you look at this image right here, you'll see the anterior horn right there. Then we have the body right here, the posterior horn, which is right there, and then of course there is the inferior horn, which is right there. So the lateral body, it is contained in the frontal and the parietal lobes. That is important for the lateral ventricle, and it extends from the interventricular foramen of the Monroe to the splenium of the corpus callosum. So the total body is starting from here, and it goes over here like this. So the anterior horn, which is right here, it is present in the frontal lobe is right there, and the posterior horn, it's on the back, it's present in the occipital horn. So it's like curves like this. It curves the posterior medially into the occipital lobe. The inferior lobe, however, is the largest compartment of the lateral ventricle, and it extends forward into the temporal lobe. So on the lateral structure, you cannot appreciate it this way because this is the inferior horn right here. This is the inferior horn, but let's look at this picture right here. So you see these are the lateral ventricles like this. So this part right here is the inferior horn, and it is curving into the temporal horn. So into the temporal lobe. So the next one is the third ventricle. It is a very small midline slit-like cavity, and it is derived from the primitive forebrain vesicle, and it is a cavity within the diencephalon. There's not too much to remember there, but it's very important as well because it's actually communication between the lateral ventricle and the fourth ventricle. So if you look at the image right here, you will see the third ventricle, it's right there, but of course we are looking from the lateral view. From the frontal view, this is the third ventricle. The next one is the fourth ventricle. Fourth ventricle in itself is also very important. The fourth ventricle, of course, it's present between the brainstem anteriorly and the cerebellum on the posterior. So I have shown here, this is the lateral ventricle, this is the third ventricle, and this one right here, this green structure is the fourth ventricle. So I have zoomed the picture right here. This is the fourth ventricle. The brainstem is in front and cerebellum is posteriorly present. So it has different foramen and the communication which allows the CSF, the cerebrospinal fluid, to enter into the subarachnoid space into the brain and the spinal cord. So let's look at the communications. Again, you have the entire ventricle system in front of you. These two are lateral ventricles. This is the third ventricle and this is the fourth ventricle. So how do they communicate? Of course, we're going to look at from the lateral view to make it more sense to you. So this is the anterior horn of the lateral ventricle, posterior horns right there, and the inferior horns are right there. So the very first one is the interventricular foramen or foramen of Monroe. The cerebrospinal fluid flows from there to here into the third ventricle. This one right here, this is the canal, or this is the connection. The next one is the cerebral aqueduct or aqueduct of Sylvius, which connects the third ventricle to the fourth ventricle. So this one right here is the cerebral aqueduct of Sylvius. Now, of course, if you remember the picture from the from the previous slides of the lateral ventricles, you see that on the anterior view it goes like this, just like a little bit of a heart shape, but the third ventricle is in the middle and it has the cerebral aqueduct of Sylvius goes in the midline. So this is the aqueduct right here that connects. It's behind the inferior horn right there. Now we're going to look at the fourth ventricle. So fourth ventricle have three different foramen. The lateral aperture is called the foramen of Luschka, which is right here. Then we have the median aperture, which is the foramen of Magendie, which is right there. And then of course there is the central canal, which sends the cerebrospinal fluid down inferiorly into the spinal cord. So now we're going to look at the circumventricular organs in the lateral and in the ventricular system. So these are the structures which are characterized by the extensive and highly permeable capillaries, and these organs surround the third and the fourth ventricle. So this is important. Third and the fourth ventricle surrounds these organs, and this region do not typically contains the blood-brain barrier. So when you're going to look into the histology, the blood-brain barrier is very important. So that the cerebrospinal fluid and the blood do not mix with each other, but here they do not typically have the blood-brain barrier. So what it does, it allows for the communication between the peripheral blood and the cerebrospinal fluid. So let's look at the choroid plexus. The choroid plexus is very important. It is basically a vascular pia mater, and it is present in all the ventricles. The location of this choroid plexus is also very important. So in the lateral ventricles, it is present in two places. So let's see. One is the temporal horns, and the second one is the floor of the body of the ventricles. So this is the lateral ventricle right here. So floor of the body and the lateral horns or the inferior horns. So this is where the choroid plexus is present. So it's on both sides. The next one is the roof of the third ventricle. This is the third ventricle and the roof of the third ventricle, and the medullary region of the fourth ventricle extending through the foramen of Luschka. If you remember, foramen of Luschka is the lateral aperture. So this is the fourth ventricle right here, and this is where the choroid plexus is present over there. Now let's look at the choroid plexus in detail. So basically it has a villous appearance, just like a villi. It has that appearance with the blood vessels in the middle. So you see this is the blood vessel right there, and there's a blood CSF barrier followed by the choroid epithelium. So let's look at this picture again. So you have the blood capillary right there. You have the endothelium right here, endothelial cells. Outside here is the pericyte. These cells are pericyte. Now inside the villi you have the stromal space, and then you have the choroid epithelium right there, and then you have a ventricular space right there, and there's a macrophage present as well. So this is basically a fenestrated capillaries, and this is the endothelium of it. So that's where the choroid plexus is. So choroid plexus actively secretes the CSF in the lateral, third and the fourth ventricle. What is the CSF? So CSF, again, it is a very clear colorless liquid which contains the small amount of protein. So that is the normal composition of the choroid plexus. What does it do? It provides the buoyancy to the brainstem and the foramen of magnum, and the protection from the countercoup injury. So what is a countercoup and injury? Sorry. So let's see. This is the head. Let's look at from the anterior way. This is ears. You can say that. Now above this line, brain is present. So this is the right side. This is the left side. If there is an injury to the head from this side, the effect is going to be happening on the other side. So this is the countercoup energy, countercoup injury. So it provides the protection against it. It regulates the chemical concentration of the neurotransmitters and the metabolic waste. So that is one of the important functions of the cerebrospinal fluid. What are the different features? First of all, the volume. The volume is 150 milliliters, and it is constantly produced, and the constant production rate is 500 ml per day. 500 ml per day is the production rate of cerebrospinal fluid, and it is reabsorbed at the same rate. Now imagine if there is a flux of there's a different flux, there's a different features, it's being produced at the same rate, but if it is not reabsorbed back the same way, then it's going to cause a pathology. What is the pressure that it exerts? It exerts the pressure of 10 millimeters of mercury. Now, how does the circulation of cerebrospinal fluid occur? So now let's remind ourselves how it is produced. So it is produced in the choroid plexus. So choroid plexus is present right here, lateral ventricles, then we have third ventricle, and then we have the fourth ventricle, three different places where it is. The cerebrospinal fluid is going from lateral to third ventricle via the aqueduct of Sylvius, with the interventricular foramen from third to fourth through the aqueduct of Sylvius, and then it's going to exit the fourth ventricle through the three different places. One is the foramen of Luschka, foramen of Magendie, and the central canal. So now let's see, the CSF is already produced, so it is circulated down into the central canal of the spinal cord. Then it's going to go back here, and it's also moving anteriorly. So it's going to go all the way up here. So that's how the circulation is happening. So you look at these little protrusion of the arachnoid space. This is called the arachnoid granulations. If you remember your lesson from the dural venous sinuses, the arachnoid granulation is basically a protrusions of the arachnoid mater into the dural venous sinuses, and that's where the CSF is being reabsorbed into the bloodstream. Over here is the superior sagittal sinus on top of it right here, superior sagittal sinus. So remember this. So again, production of CSF in the ventricles, it flows through different foramen into the subarachnoid space, flows freely, which is very important. Within the subarachnoid space of the brain and spinal cord, CSF is reabsorbed by the arachnoid granulation back into the venous circulations, as I just explained. So let's look at the clinical relevance of the cerebrospinal fluid. The presence of the cerebrospinal fluid into the lumbar puncture. So if there is a certain things that are being shown there, what does it show? If there is a presence of the RBC, then this means that there is a bleed into the CSF. Somewhere the bleed is occurring into the central nervous system. If there is a presence of neutrophils, that means there is a bacterial infection. If there is a presence of lymphocytes, we have a viral infection. And if there is the abnormal cells present outside these parameters, then you can suspect a tumor. In the next slides, we're going to look at the clinical correlations of cerebrospinal fluid or in the ventricle system. The very first one is the hydrocephalus. It is caused by the accumulation of the CSF within the ventricular system. So there's a pathology somewhere that is actually making the accumulation of CSF, and the flow is not occurring. So anywhere if there is a flow and there is a stoppage of the flow, you have to identify that on your clinical settings. If that flow is not happening, that means there is some problem there, and the CSF is constantly being produced at 500 milliliters per day and being reabsorbed at the same rate. So clinical presentation, it could include headache because the CSF is pressing on the brain. There's behavior changes, there's developmental delays, and nausea and vomiting, and it is confirmed with the neuroimaging. So the age is not a thing here, so it could be at any age. What is the normal pressure hydrocephalus? Normal pressure hydrocephalus is the enlargement of the ventricles without the detectable elevations in the ICP or intracranial pressures. So there is the age factor here, adults above the age of 60. Symptoms would include the triad of urinary incontinence, ataxia, and cognitive dysfunctions. And you can remember this from the mnemonic wet, wobbly, and wacky. WWW. Wet, wobbly, and wacky. Now the next one we're going to look at is the chronic microvasculature ischemic disease. It is a chronic atherosclerotic disease, typically resulting in the hypoperfusion to the symmetric areas of the cerebral cortex, and it causes the cerebral atrophy and other brain malformation. ICP is not raised. The next one is the Chiari malformations. It's also a group of disorders defined by the structural deficits in the brain and the spinal cord, leading to the limited space in the posterior fossa, and it forces the cerebellar structures to protrude through the foramen of Magnum, which is also very dangerous for the patient. With this slide, we're going to end our presentation in the in the ventricular system. If you want to, please follow my channel, and I will come back with more presentations on neuroanatomy. The next slides that I'm preparing right now is on the cranial nerves. So we're going to discuss that in much more detail. Thank you so much for participating in this discussion. Please leave a question if you have any. Thank you, and I will see you soon.